Transplantation, managing medications for post-transplant adherence. Um, if you have any questions, please put them in the chat box or raise your hand. And today's presenter is Gabrielle Busk, and she is our kidney transplant clinical pharmacist. Thank you so much, Gabby.
Thanks so much, Eliza, and thanks everyone for joining today and to make some time to learn about post-transplant medications. I'm Gabby. I'm a kidney transplant pharmacist here at Cornell, and I'm a member of the transplant team. I'll be involved in your post-transplant care, and I will help you to get to know your medications and help you understand how you can get the most out of them as well. So here's our outline for today. First, I'll explain the importance of post-transplant medications, and then we'll discuss the opportunities for medication education and the materials that you're going to receive after transplant that will allow you to get to know your medications. And then we'll also review some of the main anti-rejection medications and the main anti-infection medications as well. And we'll close with some key takeaways. All right, so why do we even need medications after transplant? So our immune systems have evolved over millions of years to recognize and destroy anything that doesn't belong. And so this protects us from invaders, things like infections and cancer. But when you get a kidney transplant from someone else to your immune system, that kidney also looks like a foreign invader. So without medications, your immune system wants to attack the new organ to protect you. And this is what we call rejection. So anti-rejection medications are needed to calm down the immune system and to stop it from attacking the new transplanted kidney. So in doing this, they help the kidney stay healthy and working. There's three main categories of medications that you're going to be taking after transplant. Anti-rejection medications to protect the new kidney, and then also medications to prevent infection. This also protects you from harmful invaders and everything else. Starting off with anti-rejection medications, we also refer to these as immunosuppression or immunosuppressants. And the usual regimen is made up of 2 to 3 medications that work together to prevent the immune system from attacking and damaging the transplanted kidney. These medications are taken for life, but the doses can be reduced over time since the risk of rejection also tends to go down as time goes on. Next, we have anti-infection medications, and we also call these prophylaxis. And patients usually take 2 to 3 of these medications depending on their risk for certain infections. And these are all temporary since the highest risk for infection is right after the transplant due to the strong anti-rejection medications that are given at the hospital at the time of transplant. And as time goes on, the risk of infection goes down and the anti-infection medications are stopped after several months. And then after transplant, you will see that many of the medications you were taking before the transplant might be stopped or changed, but some of them might be continued depending on what you were taking them for. And you might also notice that there are some new medications, for example, medications for blood pressure or for blood sugars. So it's extremely important that you take your medications exactly as prescribed. Every time that you miss a dose of your medications, you give your immune system a chance to attack the kidney. So you should never intentionally skip or miss a dose of your medications. Even in, for example, in 10 years from your transplant, even if you're feeling great and you haven't had any issues, if you start to miss doses, that gives your body the opportunity to reject the kidney. So you are always at risk of rejection, even if that risk goes down over time. You should also be diligent about following up with your pharmacy to refill your medications to make sure that there are no lapses in therapy. And we recommend that you call your pharmacy approximately a week ahead of when your medications would run out, so that they can make sure to have the prescriptions for you, and that they have enough time to fill them and work through any insurance problems and communicate with the prescriber if that's necessary. So you never want to wait till the last minute. Just in case something happens, we never want you to go without pills. Also, always keep an accurate medication list with you to bring to your post-transplant clinic appointments, as well as to any other doctor's appointments, so that everyone who's taking care of you knows exactly what you're taking. And by doing all of these things all of the time, you're demonstrating adherence to your medication regimen, which is key to a successful transplant. All right, so let's get to know some of these medications. So in order to demonstrate adherence, which we just talked about, it's essential that you have a good understanding of your post-transplant medication regimen. So thank you for taking the time to attend this webinar. This is an excellent first step. After the transplant, you're going to complete medication education in an individual session with the clinical pharmacist. And in this education session, we're going to go through a lot of new information, which can be overwhelming. So it's great if you can have at least one additional person present who will be active in your post-transplant care to be there for support during that education session. So what do I mean when I say that you need a good understanding of your medications? So here's what you're expected to know for each of your medications: the medication name, and that includes both generic and brand name; the purpose of the medication, so why are you taking it; and then the instructions, so how to take it, and that includes the correct doses and the correct times. The clinical pharmacist is going to provide you with a new medication list before discharge, and this list shows you all of the medications that you're going to be taking post-transplant and that key information that you need to know, so the medication name, purpose, and the instructions. Always follow the medication list instructions. If there's discrepancies between the medication list that you will get and the instructions on the pill bottles, always follow the medication list, because the pill bottles, the instructions on those are often inaccurate or outdated because they don't change as fast as the changes that we make to your regimen when we see you in clinic. So especially in the beginning, we might make changes to your regimen every week or even sometimes more, but we don't necessarily send a new prescription every time. We might just tell you to increase the number of capsules that you're taking for a certain medication. So because of that, the directions on the pill bottles are more than likely outdated. And then bring a copy of your medication lists again to each appointment. So here's an example medication list. On the left, we have the medication and the written directions. And then on the right, you have a grid with check marks that show you exactly how many pills to take and when. So now let's identify the important components that you need to know. So first we have the medication name. So the generic name here, put in a red box, for example, mycophenolate. And then the brand name is in a blue box, and that's written right below. So for mycophenolate, the brand name is Celcept. One of the brand names is Celcept, and so on. And then we have the purpose. So that's written here twice in this purple box. So all of these medications, they prevent rejection. And then how to take it. So you have written directions that are on the left, and then on the right you have another way to visualize the dose and the times. So this is also an important tool that you can use when filling your pill box, which you will receive at the time of medication education in the hospital. And it tells you exactly how many pills to put in each slot of the box. It lines up really well with that. So that's another important use for the medication list. In addition to the medication list, here's what else you're going to receive in your discharge goodie bag. So you'll get additional written materials and handouts, a month's supply of the new medications, the pill box that I just mentioned, and then some things that are important to monitor your progress at home. So blood pressure monitor, a thermometer, and a scale for your weight. All right, so now let's review these post-transplant medications. For anti-rejection medications, there will be 2 to 3 medications which you will take together to prevent rejection. So for most people, that will be tacrolimus. We also call this one Prograf, or mycophenolate, Celsect. And some people will also have prednisone as a third medication. So the first of these, we'll go over is tacrolimus or Prograf, and it comes in 3 different capsule strengths. We have a 0.5 milligram capsule, 1 milligram capsule, and a 5 milligram capsule. And you might need multiple different capsule strengths to make up the prescribed dose. And the dose will be unique to you based off of your blood work, but it's taken twice a day, 12 hours apart. And you can take it with or without food, but it needs to be taken the same way each time. There are many generic brands available. The capsules that you receive might or might not look like what's presented here on the slide. And we usually prefer that you stick with the same brand. So if you notice that your pills look different, just let us know. This is especially important if you were to switch pharmacies, for example. So let's talk a little bit more about the dose. So Prograf is a unique medication. Everyone's body processes it completely differently, so everyone needs a different amount to achieve a specific concentration in the blood. So how will we know how much your body needs? Well, we're actually going to go measure it, measure the amount of the medication in your blood and adjust the dose based off of the result. So we want enough of the medication to prevent rejection, but we don't want too much that it causes side effects. So in doing this, we're going to find the right dose for you. And this can vary a lot from person to person. Some people need only a small amount to achieve that target that we want, while others might need more to get to that target. But just to keep in mind, it's not the number of pills that matters, it's the amount that gets into and stays into your body, which is what we're closely monitoring with those blood tests. So what you need to know are the instructions for the blood test. When you come to see us in clinic after transplant, you should just hold off on taking your medications until after they get your blood. The amount that we're measuring in your blood is what's left in your body before you take the next dose that morning. Okay, so we'll go through some example dosing regimens. These are all completely expected. It just depends on the blood levels, so everyone will be different. So if someone were to take 3 milligrams twice a day, in the morning, they would take 3 of the 1 milligram capsules, and in the evening, again, 3 of the 1 milligram capsules. So 3 twice a day. If someone needs 1.5 milligrams in the morning and 1 at night, then their regimen would look something like this. They would have a 1 milligram capsule in the morning and a 0.5 milligram capsule. And then at night, they would just have a 1 milligram capsule. And then if someone were to be taking 9 milligrams twice a day, we could do something like this. So they could take a 5 milligram capsule with 4 of the 1 milligram capsules, and same thing at night. So you can see the number of capsules varies a lot, but the number in the blood that we're measuring would be the same for all of these people. It's just because it's such a unique medication. Okay, so some potential side effects for Prograf are listed here. Not everyone experiences these side effects, but if you're experiencing tremors or shaking, it's probably because of this medication. And then other possible side effects include headache, confusion, increased blood sugar, and blood pressure. And if there's too much in the body, it can be bad for the kidney as well. So that's another reason that we're measuring those blood levels so closely. Okay, so next one, we have mycophenolate, and I already mentioned one of the brand names, Cellcept. So that's mycophenolate mofetil. There's also myfortic, which is enteric-coated mycophenolic acid. They come as, so Cellcept comes as a 250 milligram capsule and a 500 milligram tablet. So you can see that here. And then myfortic comes as a 180 milligram tablet and a 360 milligram tablet. And the 500 milligram tablet of Cellcept is actually equivalent to the 360 milligram of myfortic, and same for the 250 and the 180. So you could receive either of these after the transplant, and we consider them to be equivalent. The usual dosing regimen is 1 or 2 tablets of each, depending on which brand you're receiving, twice a day, 12 hours apart. And this one can be taken with food to reduce stomach upset. One of the main side effects is, heartburn, nausea. That tends to go away with time, especially as the kidney function improves after transplant. But that's something that can be helped with a bit of food in the stomach. And then also sometimes people can have diarrhea. We look at your blood counts as well. Sometimes people can have a low white blood cell count with this medication, so we're looking at that closely. And it can also cause birth defects. So mycophenolate and pregnancy. So females of childbearing age must use effective birth control while taking mycophenolate and for 6 weeks after stopping. And acceptable forms of birth control would be either an IUD or a combination of a hormonal contraceptive and a barrier method. But it is possible to have a healthy pregnancy after transplant, but this is discussed with the transplant team and your obstetrician. And if you plan on becoming pregnant after transplant, just tell your transplant team before trying so that we can switch around your medications and get you off of the mycophenolate. If you accidentally become pregnant after transplant, notify the transplant team immediately. And just to note that caregivers who are females of childbearing age should also wear gloves if they're ever handling the mycophenolate for this reason. Okay, and then our third anti-rejection medication is prednisone, and not everyone will be taking this, but it is a common anti-rejection medication. It usually is supplied as a 5 milligram tablet, and the number of tablets goes down over time. It starts off higher at the time of transplant, and then it will come down over the coming weeks, and eventually will just be one of the 5 milligram tablets daily, once a day, and taken with food also to minimize any stomach discomfort. So side effects for prednisone include upset stomach, weight gain, increased blood pressure and blood sugars, increased cholesterol. Sometimes people can have fungal infection in the mouth, which is very easily treated, and then there's some long-term effects as well. In the hospital, we give higher doses, so sometimes that can be associated with the side effects that are listed here, but these are very temporary high doses, just for a few days. Okay, so now let's move into the anti-infection medications. So this is 2 to 3 temporary medications. Everyone gets an antiviral medication and an antibacterial medication, and some people will also get an antifungal medication. The antiviral medication is either valganciclovir, so we call this one Valsite, or acyclovir. And then the antibacterial medication is usually Bactrim, also known as sulfamethoxazole trimethoprim. And sometimes people will also take Mepron or atovaquone. This is an alternative if someone cannot take Bactrim, or if we don't think it's the most appropriate option for them. So for antiviral, valganciclovir or Valsite, this is a 450 milligram tablet, and it's usually taken for 3 to 6 months, up to once a day. Sometimes we start off just a few times a week when the kidney is still waking up, but the maximum that we go up to is 450 milligrams daily. This one has to be taken with food as well, and side effects, not too many that you would feel, but sometimes it can be associated with a low white blood cell count, so we're also looking at that very closely. And then the other option is acyclovir. This one is less common. So this is a 400 milligram tablet, and it's taken twice a day for 3 months. Okay, and then the antibacterial medication, will go over the most common one, the Bactrim. So this is we call it a single strength tablet, 400 milligrams of sulfamethoxazole and 80 milligrams of trimethoprim, all in one tablet. And it's usually taken, it's up to once a day as well. And sometimes we'll start this one a few times a week when the kidney is still waking up. And it's usually taken for 6 to 12 months. In terms of side effects, if you notice a rash, this is something to tell your transplant team about. And it can also increase your skin sensitivity to the sun. So sun protection in general is really important after transplant. But this also, with this medication, we want to make sure you have good sunscreen. You can wear a hat and protective clothing when going outside. And this also can lower your white blood cell count. So another reason we're looking at those blood tests that you're performing routinely when you come to see us in clinic. Sometimes people will also get an antifungal medication. Usually we will use clotrimazole or Miselex. And this is a lozenge, and it can be taken usually twice a day. Sometimes we use it once a day. And this just you place it on the top of your tongue, it dissolves, and we recommend not eating or drinking for 30 minutes after. And this one, it actually also can affect your tacrolimus or prograf levels in the blood, what we're measuring and adjusting your dose off of. So this becomes just as important as your anti-rejection medications. If you're taking it, it's important to not skip any doses. It's just as important as your immunosuppression because it's affecting the levels in your blood. Okay, so now just a couple more key things and some takeaways. Transplant medications can interact with other medications. We just talked about a perfect example where the clotrimazole can increase the prograf levels, but that's totally fine because we know that you're taking it and you're taking it consistently. But if we don't know about these interactions, or if it's an accident that you're taking them together, these interactions can be dangerous and they can cause harm if they aren't addressed by the transplant team. So always please ask the transplant team before starting any new medication if you're not sure if it's okay to take it. And that includes both prescription medications and over-the-counter medications. And we advise against taking any herbal or dietary supplements, elixirs, extracts. These things also can interact with the post-transplant medications. And you'll receive a list of over-the-counter medications that are okay and safe to take after transplant, compatible with the new kidney and the medications. So one of those examples is for pain and fever relief. We recommend that you would take Tylenol in most cases. And in general, in the other options here on the slide, we consider these not to be safe for the new kidney. So that includes things like naproxen, Advil, Motrin, and high-dose aspirin, because these can damage the kidney as well. There are some food interactions to be aware of. So transplant medications can be affected by certain foods, and also these interactions can be dangerous and cause harm and affect the tacrolimus level specifically. So the most important one to know about is grapefruit and pomelo. And then we also recommend to avoid star fruit. Please read ingredient labels of fruit juices and sodas. For example, Sunny D, grapefruit, LaCroix, and Fresca, these all have grapefruit extract. So it's not as simple as just avoiding grapefruit and grapefruit juice, really going and being diligent about reading labels on things that might contain these types of fruits, because it will also affect the levels of your medications, or could affect them. Okay, so post-transplant medications, they're crucial to keep you and your new kidney healthy. You must know your medications and take them exactly as prescribed. Please make sure not to miss any doses. Even though the risk of rejection goes down over time, you're always at risk of rejection if you miss medications. And then talk to your transplant team before starting any new medications, just to make sure, that they are compatible with the new kidney and the medications that you're taking. And if you have any questions or concerns, please always feel free to reach out. We are always happy to help. And that concludes the presentation. Thank you.
Thank you so much, Gabby. Everyone who has any questions, please type your questions into the chat box or raise your hand. And if you don't have follow-up questions right at this moment in time, you can always send us an email. What a great presentation. Thank you so much. Give everyone a second. Oh, we have a hand. So let me, oh, you know what? Gabby, since I gave you host permissions, I think you may have the ability to unmute and I no longer have that. If that's something you can do. Thank you.
Hello, can you hear me?
Yes.
Yeah. How often do we get our blood levels checked for the various medications?
Right. So in the hospital, we'll check them every day. But when you go home, you'll get them checked when you come to clinic. So in the beginning, that's more frequently, and then it goes down over time. It can be like up to twice a week in the beginning.
So is the beginning the first 3 months or 6 months? Or like what would the beginning be?
So it varies per person, but it could be like just the first month for that frequently, and then it would go down from there. It depends on your progress.
And you said not everyone gets the prednisone.
Right.
Who would get that? And does everyone start out on it and then you either reduce it or eliminate it? How does the prednisone work?
So everyone gets steroids when they are in the hospital and get the transplant, and we give an IV version called methylprednisolone, but for all intents and purposes, very similar to prednisone. But when you go home, most people will go home without the oral prednisone. Some people might have what we think is a higher immune risk, and we want to make sure that they have enough immune suppression to go home with. So we would keep that on for them. And there are some other reasons too, depending on whether you were to come in on prednisone, you're already taking that, then we would continue it. So there's a few instances, but usually it's because we think that there's a higher risk of rejection, so we don't want to go to 2 medications. We'll keep all 3.
So would I continue? You said we would continue our blood pressure medicine. So would it be the exact same prescription?
So after transplant, blood pressure, it will change a lot. It's possible that we would continue what you were taking at home before, depending on what it is. Some things would not be our first choice after transplant, but sometimes people don't need the same blood pressure medications after transplant. Sometimes they don't need anything at all. So we just have to see how it goes after the transplant, and then we adjust as needed. And we add things back one by one if the blood pressure is high. And if it is low, we keep you off of the medications that you came in on. So that's why it's so important to we'll monitor, every day in the hospital, the progress and all these things, the blood pressure, the weight. When you go home, you'll keep doing that, at least twice a day, just so that we can keep a good eye on that and see if we need to make changes to the medications based off those numbers.
So while I'm in the hospital, I'm taking my regular blood pressure medicine twice a day or whatever the prescription is. Is that right?
Not necessarily.
No, no, I
Usually,
have to, oh yeah, I get it now. You have to see what's happening.
yeah, yeah. So we
Okay.
would maybe like start off, you would come to the hospital. Unless the blood pressure is very high, we would kind of hold off. After the
Okay.
transplant, we would see what the blood pressure looks like, and then, okay, do we want to add something back? Or maybe we'll just hold off for now. It's kind of
Oh,
every day we think about it like that.
okay. What about the cholesterol medicine?
Usually we would continue those.
Okay. Thank you.
No problem. Thank you. Are there any other questions?
Yeah, Gabby, there's a question in the chat box from Laura, who we know is our social worker. It says, can you explain a little bit how onboarding all of the RX instructions happens? Is it during the hospital stay, or do we get pill boxes filled? Do we bring them with us to each visit to change? How does that work? Great
Yeah, so
question.
thank you, Laura. So when you come to the hospital, you get the transplant, close to the time of discharge, you'll have that session with the clinical pharmacist, and we will give you that new list of medications. And also anything that's new for you, any new medication, we'll give a 30-day supply from one of our pharmacies. We'll bring that to bedside, and then we'll also bring your pill box, new pill box, and we'll go through the list together and fill the pill box together. So when you go home, you're going to be well set up to take your new medication regimen right when you get home. And you would want to bring your pill box, your medications, your medication list to your your following clinic appointment. Usually that's only a few days after the transplant, just discharge. And if we need to make changes, we can help you do that if you need extra support. And just, it's very, very useful for us to see your medication list in front of us when you come to see us in clinic. And so it's super clear to us what you're taking, as well as your pill box. And we can identify also if you do need extra support to like fill the pill box and you want to maybe go over some of the medication information, you have questions, also happy to do that in the clinic appointment.
Thank you, Gabby. That's so helpful and important. I really appreciate you taking the time. If there's any other questions, this is your chance. As always, if you have questions after this and want to reach out to us for follow-up, we are happy to, send any question to Gabby. But it looks like we are going to give everyone some time back and really, really appreciate everyone taking time to join us today. Thank you so much. And all right, everyone, have a great day.
Thanks so much, Alexa.
Bye. Thank you.